Our next speaker is Dr. Justine, and Dr. Lee is a criticalist and a toxicologist. And she also has a little side gig going that I think we're going to maybe hear a little bit more about. Is it working? You ready?
All right.
I would say if you're ready to go ahead and like us, but make it quick.
I talked way more glory, so I have to warn you guys. My name is Justine Lee, and I'm a criticalist and toxicologist. I'm the founder and CEO of VetGirl. Super excited to be here, and my big surprise is I was a C student at Cornell. And remember, C stands for clinical. This was the first emergency case I ever saw at Cornell as a vet student. It was a dog that was hit by a car, had a pop-toast eye, owned by this huge Harley-Davidson guy. And I was really proud of myself because I was completely calm and triaged it appropriately. Until he said to me, yeah, the same thing happened to my eye when I got hit on my Harley. At which point, I was completely grossed out, sprinted, grabbed the dog, and ran to ICU. You can tell I trained at Penn, also in Boston. You are going to see cases in your career that break your hearts. You're going to see pit bull fights. You're going to see sad ones. You're going to see disgusting ones that break your heart. And ultimately, while we always want to practice the highest quality care, you can literally spit in that wound, stick it on cloud box, and it's going to do okay. It's animals rock. The most important thing to remember is don't give up on patients. Despite the improvements in quality of care, despite the disgusting cases we see, these patients do fine. So don't give up on them. Take a little bit of leash, pull out the stick, and they're going to live. Don't worry. When it comes to cases, the most important thing is don't get compassion fatigue. I've been doing ER for 15 years, and remember, euthanasia is a gift of veterinary medicine. When an owner has no money, this dog may be completely cardiovascularly stable, but if they can't afford $10,000 in the clubbing home, it's more plain to euthanize. This hit by car dog survived with great. You can do bandage changes every single day on this dog, and he did fine. So again, while humane euthanasia is a gift that we have, remember, there's a lot of animals we can save. Most importantly, my motto in life is treat every patient the way you would treat them if it was your own dog. If you have financial constraints because you're a poor vet student, you're not going to do a CBC-10 weight culture, chest abdominal ultrasound on every single block cat. It's going to be acidemic. It's going to be hyperkalemic. Treat the patient. Save the money so you can save this patient, so you can unblock it, so you can get it back home. I remember as a vet student, I was petrified of sticking needles into body cavities. I have veterinarians who have cases who are too scared to do a thoracocentesis. Just do it. It's going to save the patient's life. Remember, you're going to make mistakes, but don't make the same mistake twice. You can bolus blood. You can save these patients. So when in doubt, take the time to realize that even though you don't feel comfortable, you are going to be the main lifeline for this patient. One of my favorite cases was this dog named Stoli. I'm still in touch with these owners. This dog had a known NSAID sensitivity and came in at the age of 13 years of age to the Penn emergency room and bled out and died. Came in with a PCV of 11% from one therapeutic dose of ketoprofen. A lot of people wouldn't spend $14,000 on a dog to save it, but it's something that's treatable, then try. Obviously, you want to communicate appropriately with pet owners. Stokely actually got in the Philly news for getting 40 units of blood. It had bled out from a GI ulcer. We tried medical management. We tried endoscopy, cold water injected. We finally took it to surgery and cut out 2 small 2-millimeter ulcers. And ultimately, remember, this dog did fantastic. A lot of people would have given up on a 13-year-old dog. Treat it the same way you would treat it if it was your own patient. The most important thing is remember why we do what we do. It's for the human-animal bond. It's for this kid who owns Stoli. It's for the parents who love him. And so again, treat them the same way you would if it was your own patient. The important thing about veterinary medicine is I know I look like I'm 16, but I've been practicing for 17 years, and we are, is bust your ass being a good vet. You're going to have to work 80 to 100 hours a week, but most importantly, have a life. I play ice hockey for fun. I play like ultimate frisbee. I read, I garden, I hike. You want to work hard, play hard, so make sure that you have an outlet so you don't become burnt out in your veterinary career. Because ultimately our goal is to practice the way that we're going to practice on our own pet, to always be passionate and to know that you have nothing but options in veterinary medicine. If you're fried and burnt out, do something different. Look at industry, look at a desk job, take some time off. The most important thing, I never thought as a C student I would start VetGirl and for it to be prosperous and be just a fantastic way of educating people. When in doubt, just do it.